Hi, everyone, and welcome to Health Equity Conversations. I'm Deb James, and today we're discussing implicit bias in healthcare, what it is, and how it can affect patient care. And understanding implicit bias helps us move toward a fairer, more equitable health system. So let's get started. What is implicit bias? Implicit bias is an unconscious attitude or stereotype that can shape how we interpret information as well as make decisions. Even healthcare providers, despite the goal of helping patients, can be influenced by these biases because implicit biases operate below awareness. They can affect care without anyone noticing, making these biases harder to address but essential to confront. And let me make it very clear. Everyone has implicit biases. We all do. If we think we don't, that's one right there. We do. So let's get into a real world situation for implicit bias in healthcare, specifically cardiovascular care. Even unintentional bias and stereotyping can influence who receives the most appropriate interventions and who may receive less effective or potentially harmful care. In a study conducted from October of 2021 to October of 2022, they examined racial bias in decisions about restoring blood flow below the knee for narrowed or blocked arteries. Among 218 vascular specialists, 157, a whopping 72%, showed a pro-white bias. And in that study, Black patients treated by physicians with a pro-white bias had higher odds of receiving procedures typically reserved for high amputation risk cases. They also had higher odds of amputation within 1 year, regardless of the location of the blockage that was treated, compared with white patients. So, what that means is, regardless of how severe their blockage was, they received care for a more emergent situation. The authors concluded that implicit bias may contribute to harmful care decisions and to Black-white outcome disparities in the U.S. This example shows how implicit bias can shape clinical decisions and ultimately patient outcomes. Why addressing this implicit bias matters? Implicit bias can and has contributed to delayed diagnoses, worse outcomes, including death, and widening health disparities. It can also erode trust, making patients less likely to seek care or follow a treatment plan. I don't know about you, but if there's someone treating me that I don't necessarily trust, I may not follow exactly what they want me to do. Many institutions are addressing this by responding with training, bias screening tools, and community engagement. But let me be clear, these efforts only go as far as the leaders and clinicians are willing to examine and change, repeat, and change their own assumptions. Recognizing and addressing implicit bias isn't just important, it's critical to building equitable healthcare. I'd like to hear your thoughts. Where have you seen implicit bias affect care? And what steps can we take to reduce it? If you're comfortable, share your ideas and comments or stories in the comments below. If you'd rather not post publicly, feel free to message me. I will respond directly to you. If this conversation resonates with you, please like and subscribe for more discussions on health equity. Also, feel free to share to someone that you think needs to hear this conversation. Together, we can drive real change. All right. See you next time. Take care.